Hello everyone, welcome back again to my channel. So this is Nurse Annie again, and to those of you who are new here, welcome and thank you for tuning in. So today's video is the 6th episode of the series Common Medical Surgical Admissions. So today's episode is all about the sepsis admission. So if you are interested on this topic, then keep on watching. Okay, so for those who don't know, sepsis is actually the body's extreme response to an infection, and it's actually a life-threatening medical emergency, and it happens when an infection you already have triggers a chain reaction throughout your body and damages its own tissues. Without timely treatment, of course, sepsis can rapidly lead to tissue damage, organ failure, and even death. Okay, so to be diagnosed with sepsis, you must have a probable or confirmed infection. So usually patients presents to the emergency room with complaints of fever, abdominal pain, diarrhea. Some patients complains of weakness, vague complaints of not feeling well, or sometimes they complains of their balance is off or have chills. Sometimes even there are changes in mental status or confusion, problems breathing, or sometimes even unconsciousness. And then, of course, naturally in emergency lab tests will be done like procalcitonin, D-dimer, blood CS. Of course, inflammatory markers will be checked, which usually shows elevated CPR or ESR. Of course, WBCs and lactic acid would be checked as well, which usually are significantly elevated. Of course, chem would generally be unremarkable. If urinalysis will be done, usually it would show consistent with UTI. Majority of these patients as well are noted to be hypotensive, tachycardic, tachypneic. Sometimes their oxygenation are low. Of course, sometimes they are feverish. That's why in emergency department, with initial treatments being done, antibiotics will be started, IV boluses will be given. Of course, IV fluids will be started as well. Continuous IV fluids will be started as well. And then, of course, after they will be settled in emergency department, then they will be admitted in our medical surgical floor. And so once these patients are admitted on our medical surgical floor, you would note that doctor's order would include to continue IV antibiotics, which usually are broad spectrum antibiotics pending blood culture results. Of course, there'd be a continuous IV fluid infusion, supportive care like analgesics, antipyretics. There would also be an order to consult the infectious diseases doctors. Of course, there would also be a repeat lab orders to trend lactic acid or these inflammatory markers. Sometimes serial CBCs will be ordered to monitor the WBCs and the platelet to make sure it doesn't get worse. And of course, not to mention the DVT prophylaxis and the stress prophylaxis like Lovenox, Protonix, and those sort of stuff. Needless to say, as a medical surgical nurse, of course, our nursing care plans for patients with sepsis involves making sure antibiotics are administered on time, since these are critical tools for treating sepsis. Of course, maintaining adequate tissue perfusion or circulatory volume by monitoring patients' hemodynamics like the blood pressure, urine output, autosaturations, and of course, monitoring vital signs is a must in creating the right plan of care for these patients. Nursing care plans, of course, for these patients also involves preventing complications, and we have to provide these patients with information about disease processes, prognosis, and treatment needs. Actually, as part of our HCAPs, every patients that are admitted for sepsis are given the sepsis educational material, which is of course the responsibility of the nurse. And then naturally, if these patients are for discharge, it is also our responsibility as nurses to educate these patients. And our education should include, of course, infection control, like hand hygiene. We have to advise them to monitor their vital signs, noting chills, sweats, body aches, nausea, vomiting, or even fast heartbeat, dizziness when standing, or even confusion. And we have to tell them to see their doctor if these signs and symptoms persist. And of course, advise them to increase their oral fluid intake to prevent dehydration. And of course, any other education you can give to these patients upon discharge. Okay, so there you go, friends, with my video for today about sepsis, and I hope you have learned a thing or two on this video. And of course, if you did, please don't forget to hit that like and share button. And of course, to those of you again who have not yet subscribed, please do so. Hit that subscribe button and connect with us. Thank you once again, friends, and see you again on my next video. Bye bye.